This is CSAP's Science and Policy Podcast from the University of Cambridge, where we're bringing you the latest evidence and expertise to improve public policymaking.
I'm a malariologist. I don't know very much about anything else, but I know quite a lot about malaria. And I'm really interested from a biological background as how malaria is maintained in communities about transmission. Not surprisingly, many organisms have a type of malaria. And the fact that some primates have them means that, we're biologically very similar to primates, and there is this potential for movement between species. And so Plasmodium knowlesi, which is the one we were interested in, is of particular concern because the majority of malarias, they cycle in your blood, and they do this over a 48-hour period. Plasmodium knowlesi does this over a 24-hour period. The potential is for a very rapid increase in the number of parasites you have in your blood over a very short period of time, leading to hospitalization, severe disease, and in some cases death. It was thought to be a very, very rare occurrence, very sporadic, but they found that its origin was macaque. Subsequently, people then showed that actually 80 to 90% of all the malaria in Malaysia and northern Borneo were this macaque malaria. It had not only associated with severe clinical manifestations, but also with death. And actually, although the numbers are not huge, still relatively rare, but in those cases which did, it had a very high case fatality rate. We knew where individuals, we thought they might be getting those cases. So we were then able in those areas to add elements of entomology, primatology, sociology, and also some, I think, very cool work on environmental change. The hypothesis that we were addressing was that environmental change, largely human driven, was reducing the macaque sort of ecological areas and bringing macaques, mosquitoes and humans in much closer and more frequent contact. And what we were able to show, we flew some drones above the forest, and that was really eye-opening in a sense, because with the drone you can fly it every day that you want to. And that ability to fly it frequently over areas meant that we could capture quite widespread destruction of forest and habitat, from almost a day to day, a week to week, and kind of we had some collars on macaques. We were able to show that, not surprisingly, if you cut down their forests, they move. And that in that major disruption, they really range quite far until they find another patch of forest in which they settle in. But that whole thing brings them in much closer contact to humans and mosquitoes.
Hi, I'm Rob Doubleday, host of CSAP's Science and Policy Podcast. This week, in the final episode of our series on science policy and a green recovery, we're exploring the links between planetary health and human health. You've just heard from Chris Drakeley, Professor of Infection and Immunity at the London School of Hygiene and Tropical Medicine, whose works demonstrated that widespread deforestation and environmental change is driving increases in cases of zoonotic malaria in Malaysia. Throughout the rest of this episode, you'll hear from Dr. Alistair Brown, the Editor-in-Chief of the Lancet Planetary Health, Professor Matthew Baylis, who's the Oxenhale Chair in Veterinary Epidemiology at Liverpool's Institute of Infection and Global Health, and Robert Dubrow, who's Professor of Epidemiology, Environmental Health, and Faculty Director for the Yale Centre on Climate Change and Health. He's also one of the co-authors of the recently released Lancet Countdown Report on Health and Climate Change, Responding to Converging Crises. This week, I'm also joined by our guest host and producer, Kate McNeil. Turning first to you, Alistair, would you mind giving us an overview of the idea of planetary health and how it connects to human health?
So I'm the Chief Editor-in-Chief of the Lancet Planetary Health. And I think in essence, planetary health, it's simply about acknowledging that human health and well-being is dependent on a stable and functioning natural environment. So a great deal of planetary health research is designed to kind of enhance and, as far as possible, to quantify our understanding of how global environmental change drivers, things like climate change, biodiversity decline, also things like urbanization, how they impact on human health and well-being. And usually that's through, various mediating mechanisms, both environmental and also social, political, economic, which ultimately influence human health. And on the surface, it might seem kind of obvious that human health and well-being is dependent on a healthy planet. But the siloed way in which much of science and policy is habitually practiced, it kind of fails to acknowledge these fundamental connections. So, for example, there are rarely any formal links drawn between healthcare provision and climate change, or between food choices and biodiversity loss. And we know both of these factors, climate change and biodiversity loss, affect infectious disease, which is obviously front and centre in our mind at the moment because of COVID-19. So while these ideas do have a kind of a conceptual simplicity, there's actually a great deal of work that needs to be done in more closely aligning the way that we understand and manage the world with the reality that what we do impacts the world, and then that comes back to impact upon us. And I think what COVID-19 has really done is just illustrate those, is bring these themes to the surface in a very tangible and immediate way. And so for many people, the post-pandemic recovery is this opportunity for some kind of like a course correction.
In this moment, is there anything that you want UK policymakers to be thinking about?
So I think the most immediate kind of concern, I think, in most people's mind, but also because of the political context of the climate talks coming up in next year, is rapid decarbonisation. But there's also an opportunity for that decarbonisation to occur, to have some twin wins for other sectors. So the classic example would be electrification of vehicles, reducing air pollution, and then that reduces the burden of disease around air pollution, and also helps meet those goals. So I think decarbonisation is probably the top of people's agenda, but at the same time, we don't want that to happen in isolation and separate from other initiatives. I think there's also issues around resilience. I think that the COVID-19 pandemic again has really exposed some of the vulnerability in our supply chains and in the way that we organise ourselves. And so I think that there's a strong twin effort there in understanding, how can we be more resilient, but at the same time, mitigate climate change, and how can we kind of join up those agendas and be aware of what the trade-offs and what the synergies are. There's a kind of a movement, I think, towards a health in all policies kind of approach. So I think in most other agendas, there's kind of a health component. And one of the things that I think planetary health and sustainability in general is striving for is a kind of a more interdisciplinary approach to understand the world, both in terms of academia, but also in terms of the policy and world. I think that there's a lot of work going into understanding, what are the kind of double wins for health and also for the environment and also for inequality, and trying to kind of tackle these agendas at the same time, because they are intertwined. It doesn't make any sense to try and tackle them as separate.
Thank you for that, Alistair. Turning to you, Matthew. What can you tell us about how climate change affects human disease spread?
Well, from a study that we've undertaken here, we estimated that approximately half of all infectious diseases are affected by climate one way or another. It's too complicated to go through the detail. Climate will affect the pathogen, speeding up its replication or affecting its survival and spread. For diseases that are spread by insects or ticks or whatever, then climate has an effect on the biology of those organisms. And climate also affects the hosts. So in the human case, for example, it affects our behavior, and it might affect things like our immune systems and so on. So we see effects of climate on the pathogen itself, on vectors where they're involved, and on hosts. When we look at all the infectious diseases that threaten us, of which there's thousands, we find about half of them, there's evidence for some of these effects. And then we expect that a proportion of those might then be affected by climate change. Clearly, if climate affects a disease, then we expect climate change might have an influence. So the sort of things that we predict climate change will do is it can make outbreaks occur more frequently. It can make outbreaks larger. For vector-borne diseases, it can make them occur in new areas where the vectors have spread to. And in some cases, it can make an outbreak more severe. So, actual cases of disease might be more serious in some cases.
Okay, and then are there specific places or types of environments which are going to be made more vulnerable to disease by a warming climate? And are there specific families of diseases we need to be more concerned about or which presently aren't receiving the attention they deserve here?
Yes, I mean, the diseases which are most sensitive to climate and so most likely to be affected by climate change are the ones that are spread by insects and ticks and so on, ones that we call vector-borne diseases. I should say they're not the only ones, though. We would see this to some extent with diseases spread through water or in food or maybe in soil. But vector-borne diseases are particularly sensitive. And I guess the important part there is that there's no vector, there's no insect, very few, which are found everywhere in the world because they're so affected by climate themselves. And so with climate change, we see the distribution of those vectors moving. And we're seeing that now, so for example, with mosquitoes as a major vector of human diseases, we are seeing them spread in different parts of the world, but including through Europe. And we've seen invasions of the UK by mosquitoes that we know can spread dangerous viruses. So we have population in Kent of something called the Asian tiger mosquito that in the lab and in other parts of the world transmits dengue virus. That is now resident in the southeast of the UK. So we're seeing this happen, in front of our eyes. We're probably still too cold a country for those mosquitoes to transmit actual disease, certainly on any scale. But now we've got the mosquitoes here. Give it 20 years, 30 years, it might be a very different situation.
Okay, and then I guess, do we have tools available to help us manage these emerging risks, or are there steps that public health professionals and policymakers should be thinking about now?
In many cases where we know that we're threatened by disease, then our policymakers put together contingency plans. I mean, a contingency plan sounds good. Sometimes they are good, but sometimes, and maybe very often, they're written from a position of some ignorance. So, for example, when it comes to mosquito-borne diseases, and let's say another one that threatens us right at the moment called West Nile disease, which has occurred in mainland Europe a lot this last year. And, we might well get it in the UK in the next year or two. I'll be surprised if we don't. The contingency plan for that will include statements about dealing with our mosquitoes. But the reality is we don't actually have the knowledge to deal with mosquitoes because we don't know where they are. There hasn't been that much research into British mosquitoes. So it's easy to say we have a contingency plan. That doesn't necessarily mean we have a plan that's going to work. So I do think there's still some additional work to be done, really, as these threats approach and increasingly are realised. We need to be making sure we have the knowledge or the information that we need to actually deal with these diseases when they occur.
Okay, so then I guess there's more support needed for people in the scientific community. Are there particular directions that research needs to go in or particular supports that community needs to be successful in sort of combating these public health threats?
Well, if I just carry on talking about, the vector-borne diseases, the last 100 years, we've not really needed to worry about these things in the UK. I guess, we used to have malaria in the UK. The last case was in 1950, and it was quite common before then. So that was an issue, but that was at a time when, it wasn't dealing with diseases like that was not really on the agenda particularly. And I guess ever since that time, most of us have, including some of my age, have grown up without ever thinking that I might get a mosquito-borne disease in the UK or a vector-borne disease in the UK. That situation is clearly changing, and we have tick-borne diseases and mosquito-borne diseases threatening, and it's becoming something that we need to be aware of. I think it requires a wholesale change of perspective to look at what we have in the UK that can actually spread these diseases. We tend to think only of things maybe coming from other countries or risks that we take when we go abroad. But it's becoming quite clear that actually these risks are growing in the UK. We very often have the vectors ourselves that are capable of transmission. And I think it requires investment in that area if we're going to protect ourselves into the future.
Does One Health research fit within this picture?
I mean, this is certainly not just a story around human health. Animal health is very important. In fact, I've often thought of animal health as being the canary in the coal mine here. And the reason I say that is that it's very, very hard to to sort of discern or to distinguish the impact of climate change on human health, because our lives are changing so fast in every other way. And climate change happens on a very long timescale. And it's, if we were to compare our health now with 100 years ago and try to relate that to changes in climate, it's very difficult when you consider just how different everything else about our healths and our lives has changed over that 100 years. But when it comes to animals, and this depends on the animal to some extent, but if you take, let's say something like sheep farming, which is, such a massive industry in the UK, sheep farming hasn't changed much for 100 years. So those animals face the same risks, have similar lives now as they did in the past. And what we see is quite dramatic changes to the disease risks that they're facing. And we saw this with the emergence of a disease into Europe 20 years ago, and which then came into the UK. This was an African disease, but it's basically now endemic in Europe. So that's what I describe as the canary in the coal mine. It was a warning that actually these things can happen, and it's clearer to see in the animal world than the human world. So that's one area where sort of One Health is important. And that particular outbreak I've just described, led to the deaths of millions of animals. So it's certainly a challenge. But I guess the other big area where One Health is important is that this current pandemic and several previous, really serious disease crises that we've faced in the last 20 years. And I'm thinking here about Ebola and Zika and the original SARS and the influenzas. They have all spread into the human population from animals. And so they are a One Health issue. And, we clearly need to be addressing the issue of what do we need to do to stop those spillovers happening in the future. And I think that's the really big challenge that we have to address at the moment.
So could climate change help cause the next pandemic?
It can certainly contribute to it. As I described, climate change is causing insects and ticks to spread to new areas, and that can enable transmission to occur over a larger area. Many diseases, their transmission will be facilitated by, for example, warmer temperatures and so on. But I think that pandemics can be triggered by the exposure of humans to animal pathogens, in particular ones where there hasn't been that exposure very commonly before. And we see this with human activity, let's say, for example, entering rainforests, entering natural environments, deforesting and so on. And while that is not climate change per se, there's no doubt that climate change is a driver for more exploitation of the environment. As we expect the natural environment to be affected by climate change, so I expect human populations will need to start extracting more from natural environments, perhaps. There'll also be instability amongst people with migrations, for example, taking people into new areas. And ultimately, instability is a cause of disease spread. And I think climate change will be a cause of instability.
Just to follow up on that, given that not only for climate change, but for other reasons, we can expect instability to be with us for decades, what practically would you prioritize? What would you like to see governments doing to mitigate against the risk of this sort of spillovers that we're talking about?
This pandemic makes clear the costs are simply too high from exploitation of the natural environment on the scale that we've allowed to happen. It's very hard to see how it is stopped, but so for example, what power have we got to stop the Amazon being deforested as it is at the moment? It's very hard to do in the modern world, but nevertheless, the costs are so high that if the world unites to say, actually, let's now preserve our natural environment. Let's build it back up again, but let's certainly not chop any more down or remove any more. Working as a unit, I think they can deal with individual countries which are proceeding with deforestation. So I think it involves something like the United Nations. We've already got the UNEP, for example, but it needs to have some real force now, and we've just got to say, all countries have got to come together to say, well, enough is enough. We can never allow this to happen again because this has cost so much.
And of course, the work ahead goes beyond dealing with deforestation.
So it's not just deforestation. I think it's interaction with wildlife. Well, it's about interaction with wildlife, and that could be us harvesting wildlife, bringing them into farming situations, into areas where we farm, or through environmental disturbance where they themselves enter human environments. I think we should look at, for example, the bushmeat trade, collecting wild animals, taking them into environments where people go on to buy food. We need to remember that we have something like 2,000 pathogens that affect people that we know about. And most of those have come from animals. And in fact, most of them have come from about 20 animals, the 20 animals that we've domesticated. And that leaves, for mammals alone, several thousand for which they probably have, quite a large viral burden or pathogen burden that most of it has not had a chance to spill over into the human population. And I think the more we have close contact with wild animals, then we provide the opportunity for it to happen. An interesting example would be the palm civet in Asia. So the palm civet is the animal that was the intermediate for the spillover of SARS into people back in 2003. So the virus came from bats, is believed to have entered into palm civets, and then from palm civets into people. So you'd think that would be some kind of, warning that this is a potential agent in the spread of coronaviruses into people, and maybe we'd treat it accordingly. But actually what happens is people intensively farm these animals in parts of Asia for the coffee trade.
If we're to improve human health and the health of our planet, do we have to change our diets and farming practices?
We really need to look at intensive farming. It provides the perfect environment for the spread of pathogens between animals. Where we've got pig farming, for example, pigs are a very good host for coronaviruses, if we just focus on coronaviruses, and yet we farm them intensively. In theory, so far not in practice, but in theory, could provide a good environment for coronaviruses to mutate and spread and new pathogens to arise. I don't want to overplay pig farming per se, but if you look at something like fur farming, so with mink, so we intensively farm mink for their furs, and we can see the evolution of SARS-CoV-2 in front of our eyes. And the irony is that mink are very closely related to ferrets, and ferrets are well known to be the model animal that we use when studying human respiratory viruses, things like SARS and things like avian flu. It seems amazing that these pieces are not joined together. The fact that we know this is a good animal for the spread of viruses that can cause pandemics, and then in another part of our lives, we intensively farm their closest relative for their furs. And I think that while that's not anything about food, it is about farming. And I think that we need to have a sort of adult discussion about quite what we're prepared to put up with and what risks they may present to us in future.
Turning to you now, Robert, we've just heard a lot about how climate change and deforestation are likely to impact our risk of encountering infectious diseases. Will climate change also have an impact on non-communicable diseases?
I'm the faculty director of the Yale Center on Climate Change and Health, and we think about these health issues in two ways. So one is, what are the adverse health effects of climate change itself? And the other is, what are the adverse health effects of human activities that cause climate change? So first, what are the adverse health effects of climate change itself? And they are very multifaceted, and some of them may not be kind of immediately apparent. A few obvious ones are heat-related illness, and that includes things like heat exhaustion and heat stroke, but also heat exacerbates a number of chronic diseases, heart disease, kidney disease, respiratory disease. So people with chronic diseases are particularly vulnerable to the adverse effects of heat. Then, of course, there's hurricanes. The obvious risks are just plain drowning or getting hit by a tree. Maybe the less obvious risk is the disruption of medical care that often happens after a hurricane. And so, for example, one of the big climate-driven hurricane disasters in recent years was Hurricane Maria that hit Puerto Rico in 2017. So initially, after the immediate hurricane, it was estimated that there were 64 deaths from Hurricane Maria, and that remained the official death count until two epidemiologic studies were performed, trying to see was there an elevated death rate due to Maria in the months following the hurricane. And the estimates range from about 3,000 excess deaths to about 5,000 excess deaths. A large contributor to that was the disruption of medical care, because you might recall that the electric infrastructure in Puerto Rico, the transportation infrastructure, communications, et cetera, were all decimated. And so people couldn't get their medicines. They couldn't get their dialysis if they needed dialysis for kidney. They couldn't get their cancer treatment, et cetera. So that's an important factor. And it's actually much more important than the acute effects usually. Quickly, let me mention some of the other effects that we're concerned about. There are issues with food and water insecurity, just because of the effects of climate change on agriculture and because of drought. There are the wildfire issue. So that's acute effects. People who just get killed by the fire itself. But then there's the tremendous air pollution that's emitted from wildfires, which is very harmful to human health. And then there are mental health issues when people lose their homes from hurricanes or even experience hurricanes and wildfires. And then many do lose their homes and have to evacuate and become displaced. There are always health issues associated with displaced populations.
What about the health impacts of the adverse human activities which cause climate change?
So the burning of fossil fuels produces, in addition to generating greenhouse gases, mainly carbon dioxide, it also generates air pollutants, toxic air pollutants like fine particulate matter, nitrogen dioxide, ozone precursors. And in fact, fine particulate matter in particular is estimated to kill roughly 6 million people every year around the world. To a large degree, fine particulate matter is produced from burning of fossil fuels. So that's a huge health issue. A second concern is animal agriculture generates a lot of greenhouse gases, in this case, to a large degree, methane. And it turns out that, at least in the developed countries, we eat way too much meat, and it's bad for our health. And in fact, if we shift from an animal-based diet more towards a plant-based diet, it would be good for climate change because we'd be producing less methane, and it would be also good for our health. I'll mention one other example, which is that in many parts of the world, we have an automobile-based transportation system and kind of suburban sprawl, and that generates a lot of greenhouse gases, people just traveling in their individual cars. And it also means that people are getting less physical activity, and physical activity is one of the best things that people could do for their health.
This year, there's been a lot of discussion about how the ongoing COVID-19 pandemic has had a disproportionate impact on vulnerable groups in our society. Should we expect to see the same sort of issues arising with respect to the impact of climate change on health?
Let me go back to Hurricane Maria that I mentioned. Every hurricane has its own character, but in 2017, there was another very strong hurricane, Hurricane Harvey, that hit Texas and Louisiana. So Puerto Rico was highly vulnerable to a strong hurricane because it had a pre-existing weak infrastructure. On the other hand, Texas and Louisiana had their own problems, but they had a much stronger infrastructure, pre-existing infrastructure than Puerto Rico did. And therefore, the number of deaths was much less as a result of Hurricane Harvey compared to Hurricane Maria. After Hurricane Harvey, there were no major disruptions in medical care, whereas, as I pointed out earlier, after Hurricane Maria, there were major disruptions in Puerto Rico. Pretty much all of the hospitals were out of commission for a while because they didn't have electricity and that sort of thing. So that's one example. Another example, let me go back to heat. This is kind of intuitively obvious, but also it's been demonstrated by epidemiologic studies that indoor cooling is highly protective against heat-related illness. And some people have air conditioners and some don't. And who are the people who don't have access to air conditioning? It's lower income people within developed countries. And then on a kind of broader level, about 6% of households in India have air conditioning. And it's much hotter in India in general than it is in the United States. And so it's a justice issue. Air conditioning is a little complicated. This is a bit of an aside, but let me mention it because it's important, which is that, as I said, it's great to protect against heat-related illness, but it also has harms. So it actually contributes to climate change have a lot of air conditioning. Paradoxically, in cities where there's a lot of air conditioning actually contributes to the urban heat island effect. It's a challenge to develop, and people are working on this, to develop more efficient air conditioners and also other methods of indoor cooling that are a lot more energy efficient. But getting back to justice issues, so sticking with heat, so homeless people, outdoor workers, and undocumented workers in particular. A lot of farm workers are undocumented. They're highly vulnerable to heat. And let me add one other thing. With regard to the adverse health effects of human activities that cause climate change, the justice issues there, a big justice issue is that polluting infrastructure, such as electric power plants and oil refineries that produce a lot of air pollutants, they tend to be located not in rich neighborhoods, because rich people don't want them there for obvious reasons, and they have the political power to keep them from being put there. So they tend to be in poor communities of color, and that's another really important justice issue that I think needs to be named.
We're just about out of time, but just before we finish up, would you mind telling me a little bit about some of the things that we can do to mitigate the health impacts of climate change?
So thinking of this from a public health perspective, we think about what we call primary prevention, and in climate change parlance, that's called mitigation. So getting at the root of the problem in this case is reducing greenhouse gas emissions. And fundamental to that is converting from a fossil fuel-based economy to a renewable energy-based economy. Really, it's the electric sector that's key at this point. So we need to convert the generation of electricity from burning coal, oil, and natural gas to solar, wind, and possibly other renewable sources. That kind of lays the basis for electrifying transportation. Then we also need to electrify. If you cover the electricity, the building, and the transportation sectors, we're a long way to where we need to be in terms of reducing greenhouse gas emissions and getting to a net zero economy. There are still issues, but it's mainly, at this point, in my opinion, it's mainly kind of an issue of political will and resource investment. We also think about what we call secondary prevention, which climate change people call adaptation. Even if we start aggressive mitigation right now, it won't be effective immediately. We kind of have at least another several decades of warming baked into the system at this point. So what are we going to do about it with regard to health in order to protect people from these adverse climate change impacts? So heat is that's the obvious issue. And that's especially a problem in cities. So it's good for cities to have high albedo surfaces. And that's an adaptation measure. So you could have high albedo roofs that reflect the heat instead of absorb the heat. Same with pavement. And then another simple and really important adaptation measure is planting urban trees. So it takes time for them to grow to be high enough to provide the shade, but better now than later to do that. Then also green roofs help with adaptation with regard to heat. So that's a double benefit, because you could actually have gardens depending on the type of roof. If you have a flat roof, you could have a garden on a roof, and that helps cool, and it also provides food. So urban agriculture is an important adaptation measure for this food security issues. Let me give another example, which is, I'll stick with heat. So occupational heat stress is an important issue, especially for outdoor workers like farm workers or construction workers. And the very simple adaptation for them on hot days is water, rest, and shade. So it sounds simple, but a lot of employers, don't necessarily want to provide that because they might feel that it impacts on productivity. So you need kind of policy and legislation and regulations in order to ensure that employers provide those basic safety health and safety measures for employees. Yeah, so that, I think that gives you an idea of what we're talking about when we speak about adaptation.
Thank you all for joining us for this, the final episode of our series on science, policy and a green recovery. If you've enjoyed listening to this season, please let us know by rating us wherever you get your podcasts and by sharing the series with your friends. We're off air in January, but we'll be back in February with a new series exploring pressing science policy questions involved in ongoing genetic research. In the meantime, stay tuned for bonus content and have a very happy Christmas and a great new year. CSAP's Science and Policy podcast is a production of the Centre for Science and Policy at the University of Cambridge. This series is produced in partnership with Cambridge Zero. This episode was hosted by me, Rob Doubleday, and was produced by Kate McNeil. You can learn more about CSAP's work by visiting us on Twitter at CSciPol or at our website www.csap.cam.ac.uk. If you have any feedback about this episode or questions you'd like us to address in a future week, please email inquiries@csap.cam.ac.uk. Thanks for listening.